Hello and welcome. I'm Ray Upchurch and you're watching the Trey Heart Learning Channel. Today I'm going to be talking about heart failure, some of its symptoms, and how we can control those symptoms. I have some notes in front of me and we'll be referring to these at time to time. But hopefully today we're going to have a good discussion and you'll be able to learn what you can do for some of your symptoms of heart failure. So people ask me, what are the symptoms of heart failure and what causes them? Well, some of the main symptoms of heart failure are swelling in your legs, in your ankles, in your abdomen, in your back, feeling shortness of breath, feeling tired, or feeling extremely lethargic, like you have no energy. So what causes this? Well, in heart failure, remember the last time we talked about heart failure, we said it's the failure to move fluids and blood around your body the way it should do. Well, that's exactly it. Because it's not moving the fluids or the blood through your body the way it should do, and salts through your body the way it should do, these start to build up in areas such as your lungs, your ankles, your legs, and your back. So as these start to build up, the heart thinks, well, I need to work harder and try to move these things around the body more efficiently. Well, it tries to work harder, but unfortunately, it's still not able to efficiently move these around your body, so it starts like a loop. As the fluid and congestion starts building up in your body, your heart's like, I got to work harder to move these out, and so more fluid and congestions build up, and so the heart thinks, as I got to work harder. So this fluid starts going into different places. One of these is like your lungs, which causes the shortness of breath. Your legs, which causes the swelling in your ankles, your knees. It goes into your back, and it goes into your abdomen. But as the fluid starts to build up and it starts to go into your joints and stuff, this is what causes the fatigue, the feeling of tiredness, like I have no energy. So this is what causes these symptoms. Is your heart's unable to do it efficiently, they start to build up, and your symptoms start to develop because the buildup is not moving the fluid around your body or out of your body the way it should do. Now, let's talk about some of the symptoms that are commonly associated with people that have heart failure. One of the symptoms that may be associated or is commonly associated is a symptom of having chest pain or chest tightness, or sometimes both. This is what some doctors refer to as angina. So what would you do for these symptoms? The answer to this resides in, is this the first time it happened to you? If the answer to this is yes, then you should immediately call the emergency services associated with your country. For example, in the United States, it's 911 even. In Britain, it's 999. Or some countries even recognize 112 as an emergency call number. So whatever call numbers associated with your country, this is what you should call. Now, some patients that have these symptoms already have a condition called congestive heart failure. And this symptom isn't new to them. And usually they are prescribed a medication called glycerin trinitrate, or GTN. This medication should be taken as prescribed when these symptoms start. So when these symptoms start, the doctor will tell you how to take them. If you've taken these medications as prescribed and they didn't work, then you should immediately call the emergency services associated with your country. Some symptoms also associated with heart failure is blackouts. Blackouts in the medical world sometimes is called syncope. So sometimes the doctors, when they're talking to you and you go in and you say, hey, I've been having blackouts, and they say, oh, you've been having syncope, and you say, syncope what? Well, that's what they're talking about. Syncope means blackouts. So syncope or blackouts is always a serious condition. You should always talk to your healthcare professional about it. And if anybody around you witnesses you having a blackout for any length of time while you're blacked out, they should call an emergency service associated with your country. Obviously, if you're alone, you have the condition of heart failure, you can get emergency call systems. They're available in some countries, so that if you fall or if you black out and wake up, you can hit a button and it'll call an emergency line. Or if you don't have this available, as soon as you wake up, you should call emergency line associated with your country. Now, some people say, oh, I've only blacked out once, I'm okay. There's no reason to call the emergency line. Well, there is. These symptoms that cause the blackout might only be resolved temporarily and should be checked out by your healthcare provider or an emergency care center as soon as possible. Some countries and some places have emergency people that actually come to them, emergency lines where they don't have to go into the into the ER. I know when I worked in Britain, this was one of the things that we had available to some of our patients in some of the districts. If you have that available, please call it. Please get them to you, or they'll advise you to call the emergency center if they feel it's necessary. So, some people say also, because of the condition of heart failure, feel helpless, fed up, like they don't have any control over their life. When you don't feel control, or you don't feel in control of your life, or you feel helpless, it's easy to become depressed. So when these symptoms start to happen, one of the things that you should do is look around at your support system. One of the things that makes people feel more helpless is that they're not able to do things for themselves. And one of the things that we can do is look at our support system. What do we need help with? Do we need help with our family if we still got family around? Or if we are the caregiver of our companion? Do we need help with our finances? So look and see what there is, what support systems there are. Discuss this with your family, or your friends. You'll be surprised at how many people are willing to support you or be there for you if you need it. Especially if you're starting to feel depressed or feeling that you have thoughts of wanting to harm yourself, you should immediately call the emergency services that are associated with your country. There's somebody there to help you out. One of the ways that you can feel more in control is by learning about heart failure, how you can control your symptoms, and by getting a support system around you, people that are there to support you. This is one fantastic way to help you feel more in control of your symptoms and more in control of what you can do. Some people say, I have good days and bad days. Well, this is true with or without heart failure. But usually what they mean when they're talking about this is I have days where I have more energy or days where I have less energy. So today I feel like I can run a marathon, and tomorrow I feel like I can barely crawl out of bed. Well, what you should do is try to adjust your activity on a daily basis. On the days that you have more energy, don't overdo it, because this will make some of the days when you have less energy more frequent. But on the days when you have more energy, do those things that you need to do. Do some of the things that you want to do, but don't overdo it. And this will in return help your days with less energy seem like they're fewer and far between. It doesn't mean that they won't happen, but you'll find that you're able to taper your activity out so that the days where you feel like you hardly can crawl out of bed don't happen as often. So, some people with heart failure also feel lightheaded or dizzy. This can be because of the medications that they're on. This can be because of heart failure itself, causing poor oxygen getting to your brain or into your body. This can be caused by other conditions, I may have already mentioned the medications. So one of the things that you can do is if you start to develop lightheaded and dizzy, if this is a new symptom, always discuss this with your healthcare provider. It may be something that they can adjust your medications that might be able to make you less lightheaded or dizzy. If it's not a new symptom and you know about it, meaning it's not the first time it's happened to you, and you've discussed this with your healthcare provider, then there's things that you can do to help control your lightheadedness or dizziness. First off, be sure that you're hydrated adequately. That's always a double-edged sword, because sometimes with heart failure, you've been advised to drink less than what you would usually drink in a day. For example, if you usually drink 8 cups a day, you're usually advised to drink 6 cups a day so that you don't build up fluid in your body. But my advice to you is to drink as much fluid as you're allowed to by your doctor. So if your doctor allows you to drink 6 cups of fluid a day, then drink 6 cups of fluid a day. One common thing amongst patients that have heart failure is dehydration. The reason for this is they don't drink enough fluid. They don't drink the amount that they're allowed to in a day. Often, patients with heart failure are put on diuretics that help get rid of the fluid, but because of this, they don't want to drink as much fluid just in case when they're out it causes problems or it causes social problems. So my advice to you is always drink as much fluid as your doctor has allowed you to drink. Another thing that may also cause dizziness and lightheadedness, is your medications. And sometimes this is shown by having low blood pressure. And when you get up, you feel lightheaded or dizzy. So if when you get up, you feel lightheaded or dizzy, first off, you should get up slowly. If you are lying down in bed, this should actually be done in 3 stages. If you're lying down in bed, first stage would be to set up. Gather your bearings. Once you're no longer lightheaded or dizzy, then move your legs over the bed and plant your feet firmly on the floor. The reason for planting your feet firmly on the floor is because if you feel lightheaded or dizzy, if your feet aren't planted firmly on the floor, then you're likely to fall over. And I would like you to be able to push yourself back rather than allow yourself to fall forward onto the floor. So it's better to fall back onto a bed than it is to fall forward onto the floor. Once you've got your bearings and you've done your setup and you put your feet on the floor and your feet are planted and you got your bearings, if you have a mobilization device such as a walker or a cane, use it to get up. Stand up, stand there for 30 seconds to a minute to gather your bearings. My suggestion is to wait a full minute, gather your bearings, and then move. But if you are still feeling dizzy or lightheaded, do not move forward. Stay there until you stop feeling lightheaded or dizzy. If it doesn't subside, sit back down onto your bed. Always, in the modern world, we have cell phones now. Always have a cell phone somewhere close to you so that these symptoms, if they don't subside, you could call your healthcare provider or somebody that's close to you, like family or friends, to come and help you out if needed. Some people complain of memory problems. Memory problems can be associated with heart failure due to lack of oxygen in the brain. Primarily with memory problems, it can be because of lack of oxygen to the brain. It can be caused from medications, but it may be caused from other things. What I would suggest you do if you start to have memory problems and you're starting to forget things is to write things down. For example, if you have an appointment coming up, keep a calendar, keep a diary, write it down in your calendar, write it in your diary, let your family know or let your friends know. Check your calendar, check your diary daily, and have your friends call and remind you when your appointment is due. Now, when they do this, thank them for doing so. Thank them for being part of your care. Remember, you've asked them to do this, and they're not doing it to be spiteful or for any other reason. They're doing it because they love you and care about you. Some patients also have palpitations. Palpitations may or may not be because of the heart failure. So palpitations can sometimes come before you have heart failure, or maybe have nothing to do with heart failure. But if you start to develop palpitations mean it's you're feeling that your heart's beating in your chest, or that, and usually this could be normal, this could be an abnormal rhythm, or sometimes like you're missing a beat. Palpitations can be caused from anxiety, it can be caused from heart conditions, it can be caused from other things as well. So if you start to develop palpitations and you're feeling anxious before it starts, then a relaxation technique may help. But if it doesn't help, you should discuss it with your healthcare provider. By all means, if you develop palpitations and you start to develop any other symptoms, shortness of breath, pain, or anything like that, and the palpitations don't go away within a short period of time, be sure and let the emergency services in your country know. Give them a call, have them check it out. So it's better to call and get them to check it out than not to call. Some patients complain of poor sleep. Poor sleep can be part of heart failure. It's often caused from lack of activity. So I'd encourage you to get out and do some activity every day. Don't overdo it, because we've already talked about the overdoing it syndrome, the scenario. But do some activity, get some fresh air every day. In the evening, poor sleep can be caused by anxiety. So you want to try to use some relaxation techniques. Might also add a little bit of lavender oil to your bath, a warm bath, just before you go to sleep. That might help relax you. Do some aromatherapy in your house. Have some lavender oil lamps or something that might help you as well. Or have a warm drink before you, warm milky drink, I should say, before you go to sleep, and that sometimes will help you as well. One of the things that will definitely help you is make sure you have enough pillows in your bed. This usually helps resolve some of the breathlessness. If you have some of the symptoms where you're waking up and your sleep is due to coughing or frequently getting up and having to go to the toilet, those two symptoms need to be discussed with your healthcare provider. They should always be brought to the attention of your healthcare provider, because it may be because of other things. So those are some of the things you could try for poor sleep. Some patients have complained that they have problems being sexually active, and I know what you're thinking. Sex is probably the last thing on your mind. A lot of people don't feel that they have the energy for it and don't even have the desire for it. This can be because of the heart failure. It can be because of some of the medications that you're on due to the heart failure. One of the things that you absolutely need to do is discuss this with your partner. Remember, they're there for you. They're going to help you. They're going to support you with your condition of heart failure. If it's uncomfortable for you, or to discuss it with your partner, or if you just want further advice, get with your general practitioner or your healthcare worker and have them discuss it with you and your partner. Some people find this easier, some people don't. It's up to you, really. So, one of the initial discussions does need to be had with your partner, and some of the other things that could be discussed with your GP is the medications and how they may be affecting this. Some people also with heart failure complain about gaining weight, and I'm not talking about the quick weight gains. I'm talking about the slow weight gain. Now, quick weight gains is where you gain 2 to 3 pounds over a day or so, or within that week. Slow weight gain is you gain that 2 to 3 pounds but it's over a month or so. Now, slow weight gain is what I'm talking about. Quick weight gain I'm going to talk about in another video. But slow weight gain, the reason for it is because you are being less active. You're being less active. Basically, you're not as active as you used to be before, but you're eating the same amount. We tend to eat the same amount, and the unfortunate thing is when it comes to fitness, is the more weight gain that we have, the less likely we are to attempt to make ourselves more fit, because we have other symptoms. We're breathless, we're tired, so it becomes harder. So one of the ways to help us to overcome this is by portion control. Use portions control daily. If you don't know what the right portions are for you, get with your doctor. The unfortunate thing is, when it comes to portion control, you don't actually have to get with your doctor. If you have access to internet, you can look up just a healthy diet, and it'll tell you how many portions of everything you should have within a day. Specifically with heart failure. Now, I wouldn't rely on everything that the internet says, so healthcare providers always have the best information there is, or the most accurate information, I should say. Try the portion control. With not being able to sleep, we talked about doing a activity every day. Try to do an activity every day, by all means. Don't overdo it. And those things should help you maintain your weight. Now, on the opposite end, some people complain about losing weight. Now, if you are losing weight because you're on a diet, and you're on a diet because you are already overweight, then that's a good thing, and congratulations, and well done. Keep it up. Don't stop until you get to your ideal weight. That's what you want, and that's what the doctor wants. That's what the ideal goal is. But if you're unintentionally losing weight, meaning you're not on any special diet, and your weight is going down, if you're overweight, there's not a lot that the doctor will do about it, but I would go ahead and go and talk to them about it. The reason is because if you're losing weight unintentionally, there may be other things going on, and they will usually do other tests just to make sure that other things aren't going on, and adjust it if the other tests come back one way or the other. But if you are unintentionally losing weight and you're already within your weight limit, this is something you absolutely need to go to your doctor as soon as you can about. The unintentional weight loss, sometimes is caused by poor appetite, which comes with heart failure. It comes with some of the medications we give you. Unfortunately, every good thing we try to do sometimes has a bad effect, which is, the appetite sometimes is affected. Discuss this with your doctor. But there's other things your doctor will want to do. They're going to want to do other tests on you, and they're also going to want to make referrals, if needed be, to dietitians, especially if you're within the lower end of your normal weight or you're below the normal weight. They'll usually want to do a referral to a dietitian that can discuss appropriate meals that are for you, that are also within the heart failure remit, meaning that they won't harm you or harm something else that might be going on, whether you have diabetes also or something else. So they're some of the best people that could discuss this with you. So today we've had a pretty good discussion about heart failure and some of the symptoms. In the coming videos, I'm going to continue this discussion. I'm also going to discuss some of the medications that we use when it comes to heart failure, what you need to know about your medications, and when you should talk to your doctor about your medications, what signs and symptoms you need to bring to their attention in regards to your medications. So this is what we're going to be talking about in our next videos. So I hope this was useful to you and your family and your carers. So I'll see you next time. Be there.